You feel perfectly fine. No headaches. No chest pain. You're active, focused, and maybe even proud of your healthy lifestyle. Then one morning, as you're brushing your teeth, your vision suddenly blurs. The toothbrush slips from your hand. A wave of dizziness hits, and in seconds, everything goes black. At the hospital, the doctor tells your family something no one expected: a massive stroke caused by untreated high blood pressure. But how? You didn't feel anything wrong. That's the terrifying truth about high blood pressure: it rarely announces itself. It doesn't hurt. It doesn't cause fevers. It just waits, quietly damaging your body from the inside out. That's why doctors call it the silent killer. Right now, nearly half of all adults worldwide have high blood pressure, and most of them don't even know it. You might feel perfectly fine, but deep inside, your heart, brain, kidneys, and even your eyes could already be under attack. So what's really happening when your blood pressure creeps above normal levels? How can something so invisible cause strokes, heart failure, or blindness without a single warning sign? And most importantly, how can you catch it before it's too late? To understand that, let's look inside your bloodstream. Think of your arteries like flexible garden hoses that carry blood to every cell in your body. When pressure inside those hoses rises too high for too long, the walls begin to wear down, just like a hose that's constantly overinflated. At first, there's no visible leak. No alarm. But microscopic cracks begin to form. The lining of your arteries, called the endothelium, starts to weaken. Fat, calcium, and cholesterol sneak in, building tiny scars and clogs that slowly stiffen the vessel. Over time, that stiffness forces your heart to pump harder to push blood through narrow channels. Each beat becomes a struggle, and your heart, like any overworked muscle, starts to enlarge and tire. And still, you feel fine. That's the danger. Your body can quietly adapt to high pressure for months or even years. Until one day, the walls give out. Inside your body, this silent pressure isn't just stressing your heart. It's transforming the architecture of your entire vascular system. Every organ that depends on steady blood flow begins to feel the ripple effects. The brain, for instance, relies on delicate capillaries, tiny, thread-like vessels that can burst under pressure. When that happens, even a pinhead-sized rupture can flood a region of your brain, cutting off oxygen and leading to what doctors call a silent stroke. You might not collapse right away. You might just notice fogginess, slower thinking, or mild memory lapses that you brush off as stress. Meanwhile, your kidneys, your body's natural filters, are also under siege. Their intricate network of blood vessels acts like fine mesh, filtering toxins from your blood. But under chronic high pressure, those filters begin to scar. They lose efficiency. Waste builds up. And before long, your blood pressure climbs even higher, a vicious cycle that slowly feeds itself. And through all of this, there are no symptoms. Now here's where things turn even more unsettling. Because the real danger of high blood pressure isn't just what it does to your heart or kidneys, it's what it's doing silently every second to your microcirculation, the small invisible vessels that feed your eyes and brain. Imagine your arteries as highways and your capillaries as neighborhood roads. When those main roads become damaged and stiff, the pressure in the smaller ones spikes. And since those vessels are fragile, especially in the eyes and brain, they start to break down. Your vision might blur. You might see tiny black spots or floaters. These are early signs of hypertensive retinopathy, tiny hemorrhages inside your eye caused by ruptured blood vessels. Left unchecked, this can lead to permanent blindness. Yet most people ignore these signals, or never notice them until the damage is irreversible. And here's something few people realize. Every spike in blood pressure, whether it's from stress, anger, or too much salt, sends shockwaves through your arteries. Those waves hit the vessel walls like small hammer blows, gradually stripping away their elasticity. That's why people with uncontrolled hypertension age faster internally. Their arteries become stiff like old rubber tubing, their hearts grow thicker and weaker, and their organs start to starve for oxygen-rich blood. It's like rust forming inside your body, quiet, slow, and permanent. But perhaps the most chilling part? Your brain tries to adapt to the pressure by tightening and relaxing its own blood vessels. For a while, it works. But eventually, one vessel gives out. That's when you get a hemorrhagic stroke, the kind that hits without warning. A person can go from a normal conversation to complete collapse in seconds. And still, until that moment, they felt fine. That's the cruel irony of high blood pressure. It doesn't just sneak up on you, it rewards your ignorance with silence. No pain, no obvious warning. Just gradual, hidden destruction, until one day, it isn't hidden anymore. Now imagine this. You're sitting at your desk, feeling a mild headache that you blame on caffeine. You've been skipping your annual checkups because you feel healthy. Meanwhile, each heartbeat is pushing against your arteries with just a little too much force, 140, 150, sometimes higher. That might not sound catastrophic. But inside, those numbers are rewriting your biology. Your heart's left ventricle begins to thicken, trying to push harder against resistance. At first, it's a sign of adaptation. But as months pass, it becomes a sign of exhaustion. That thickened wall demands more oxygen, which the narrowed arteries can't deliver, leading to chest pain or, worse, a sudden heart attack. And if that doesn't happen first, the kidneys might fail quietly. When their filtering units, the glomeruli, scar over, waste builds up in your blood. Swelling, fatigue, and nausea follow. By the time symptoms appear, the damage is often severe. This is why doctors stress regular monitoring. Because by the time you feel high blood pressure, it's already done years of harm. So if high blood pressure can quietly destroy your organs without warning, how do you stop it before it starts? It begins with awareness. You can't fight what you don't measure. That's why doctors call blood pressure checks the most important and visible test you'll ever take. You don't need fancy hospital equipment, just a simple home monitor and consistency. If your readings hover around or above 130/80, it's time to pay attention. But let's be clear, high blood pressure isn't a death sentence. It's a signal, a warning that your body is under pressure it wasn't built to handle. And in most cases, small, consistent lifestyle changes can reverse it. Start with salt. Sodium attracts water, which increases the volume of blood in your vessels, raising pressure. Reducing processed food, chips, canned soups, and restaurant meals can drop your readings in just weeks. Next, move daily. Your arteries are like elastic bands, they stay flexible only if stretched. Even brisk walking for 30 minutes a day helps your blood vessels dilate more efficiently, reducing stress on the heart. Then, manage stress. When you're angry or anxious, your body floods with adrenaline and cortisol, hormones that constrict your vessels and spike pressure. Simple breathing exercises, mindfulness, or even stepping outside for sunlight can reset your nervous system's rhythm. And perhaps the most underrated tip, sleep. Poor sleep throws off your body's ability to regulate blood pressure, especially during the night when it should naturally dip. That's why people who sleep less than 6 hours consistently have higher rates of hypertension and heart disease. For some, diet and exercise aren't enough, and that's okay. Medication, when prescribed and monitored, isn't a weakness, it's protection. Blood pressure medicines don't cure hypertension, but they buy your organs time to heal, your arteries time to relax, and your heart time to rest. Think of them as a safety net while you rebuild your lifestyle from underneath. The real victory is catching the problem early, before your body forces you to notice it. Here's the truth most people don't realize. You'll never feel high blood pressure until it's already hurt you. But you can outsmart it, with awareness, small habits, and regular checks. So tonight, when you feel fine, remember, silence doesn't mean safety. It just means your body hasn't spoken up yet. Would you risk your heart, brain, and eyesight for a condition that's completely preventable? Tell us in the comments, and if you found this video eye-opening, make sure to subscribe for more science-backed health insights. Because sometimes, the scariest diseases are the ones you can't feel until it's too late.